other than the clinical, regulatory, insurance, all those things that we have been discussing about the next step, the other thing is about, okay, now AI and how AI could be a part of this discussion. Okay, so we know that AI is a very general term. We all know about machine learning tools. I mean, we have been using them even in high school. Now there is a significant advancement in deep learning. When I was in high school, even we have been learning how to use neural network, but they have been very simple. They have not been that much successful. I'm talking about something like 30 years ago. But now they are very, very advanced, right? So with deep learning tools, we discussed even in the previous talks that we should spend significant amount of time for modeling, right? For computational head modeling, for all those things that we have been discussing about adjusting the dose, finding the right target, things like that. And depending on what type of computer you use, it takes time. It is not a real-time processing. Those who have done free surfer analytics, those who have done simulink, they know it takes time. But now with some deep learning methods, as he mentioned, there are opportunities to make it happen in less than a second, right? So things are getting very fast, even real time, in terms of measuring all those things. And it seems that the response, all those kind of new things that are available outside, they are in a really good, kind of reasonable shape right now. So this is, so we'll discuss about different pathways that people are using that. So that is one way of using AI tools or more deep learning tools. But beyond those kind of general deep learning tools, we also have foundation models. Okay. And what is the most famous foundation models are large language models, right? So things like ChatGPT. ChatGPT is a language foundation model. Okay. And then we have vision models. Now they can recognize different things. They have their audio models, and they have their audio-visual language models that are combined with each others. But there are also science foundation models. And you probably have heard about protein foundation models. Now, the protein foundation models are revolutionizing the way that we develop medication. So there are lots of interesting things that are happening with protein foundation models. But specifically in our field, there are brain foundation models as well, right? So who can name one brain foundation model in our field? Brain LM. What else? Ilab. Brain Java. Okay, what else? Okay, so one of them that I like and I work with is called NeuroStore. Who has ever been exposed to NeuroStore? NeuroStore. Messiah, a good colleague at Laureate. So anybody else? Okay, so we'll discuss about that. So technically, we know that there are large-scale multimodal databases available outside, right? So UK Biobank is out there, ABCD is there, Human Connectome Project, different versions of Human Connectome Project. Now Enigma is getting large, and Enigma also has lots of databases. So how we use these databases and develop foundation models, fMRI foundation models, EEG foundation models, and how to use these foundation models for response prediction, disease state modeling, and eventually what we are discussing today is the stimulation plan. Okay, so that is something that we need to further discuss together today. And what are the things that we have?